Ooh, tough topic.
Egg quality.
Yes.
Yes. Now, let's just look at a hypothetical clinical scenario. A 32-year-old patient who's been married for about 3 years, being investigated quite extensively. Nothing really found. There's no male factor, there are no tubal issues, she's ovulating. She has an appropriate AMH for her age of 32 and decides to do IVF. She has put through a short cycle with an appropriate dose and her response to the stimulation has been quite appropriate. And she goes for an egg collection, and the yield is also as you would expect. So from a clinician's point of view, things look quite promising, and I would probably think that a patient such as this would be labeled as a good prognosis patient. And then the next day, we are told that egg quality was poor. That's just the next day. So I mean, we don't quite know where things would pan out from there. Now, Dean, perhaps you could share with us what your thoughts are about egg quality. What does egg quality actually mean?
That's a great question, and it's one that we struggle with because there's two basically categories of egg quality issues. One is where there are clearly some things that look abnormal with the eggs. And it's actually quite rare that that's the case. So normally when we go to do, say, ICSI at the time, the eggs look fine, the majority of cases. And so in this case, if it was the next day and we're going to go do the injection and we see that, or at the time of the pickup, when we see that a lot of the eggs don't look normal, they actually have pretty abnormal features, then we think, okay, something's not quite right in the way these follicles grew, the way these eggs developed. And this would be where there'd be multiple defects, like there'd be vacuoles, maybe smooth endoplasmic reticulum, so it's different things that we know shouldn't be there. When there's multiple ones of those, that's a pretty significant sign. Again, that's pretty rare that we see that on the day that it's that significant and severe. So mostly we'll say maybe one defect, and what we know from the literature, from science, is that when there's just one defect, it doesn't mean very much.
Sure. So are you then saying that first of all, you're saying that egg quality is an eyeball thingy? You're going to look at it and you're going to give a global assessment to what your thoughts are about the egg. So it's a very subjective.
Very subjective. And I would say probably 98% of cycles, we are just totally guessing about egg quality by looking at them because it doesn't tell us the full story.
Sure. So would you normally grade eggs when you look at them? Would you categorize them as whatever?
Basically, the pretty standard way of doing it is to say these look normal, within the normal range. There's some that have some things that aren't quite as acceptable, but they're okay.
Sure.
And then there's occasions where you say these eggs really are abnormal from the beginning. But again, that's really rare.
So would I be wrong if I said that you probably look at them and say these are okay?
Yeah.
And unless they really didn't look okay, and that would just be the minority.
Absolutely. Yeah. So at that point, we really don't have much way of knowing. It is very subjective.
How many percent?
Like 2%.
2%.
Yeah.
Right. So you're saying that generally across the board, regardless of what they look like, about 98% of the time they would probably fall into the okay category.
Yes.
That's a very interesting and very fair way of looking at it.
So, and unfortunately, we don't have much information on what to do. In the cases, those 2% where we see something that really looks abnormal, what do we do about that?
Sure.
And we don't have any idea about why the eggs are that way.
Sure.
There's some ideas that we have that you probably from the clinical side can say, what could we do differently? What could the patient do differently?
Yes. Sure.
But it's really, because it's so rare, it's not something that's really been studied much.
Sure. And if you did see that 2% of eggs that didn't quite fit your okay group of eggs, what do you think would happen then? I mean, would they fertilize or would they not fertilize?
So what we know from, again, the published studies on it and experience is that they just have a lower chance of fertilizing. They have a lower chance of making an embryo that will become a baby.
Sure.
But it's not zero.
Right.
It's not an absolute.
Yes. Yeah, that's quite interesting as well. Yeah. I'll tell you why. Because a long time ago, a senior embryologist told me that, hey, even if it looked ugly, and you would have otherwise labeled it as, you know, an extremely poor quality egg, if it fertilized and it became a nice looking embryo, or rather an embryo that was worth putting back, you would still put it back, and you could still get your pregnancy.
Yes.
So finally, it was the end outcome
Yes.
that really made a difference,
Yes.
rather than, you know, trying to pass
Yeah.
judgment at that point.
Yeah. It's an interesting point, and one of the things about it is that, you know, mom's responsibility is to provide this egg, and within that egg is all the components that allow the embryo to grow to like day 3.
Sure.
And on day 3, that's when the embryo takes over with its own genes and says, okay, I'm in charge now. But up to that point, up to the 3rd day of embryos, you know, it's basically relying on mom's contribution from what's in the egg. If there's enough there, and even if it looks really bad, but there's enough to get it to the point where the embryo takes over, suddenly it's like, okay, it doesn't matter what mom gave me, now I'm in charge and I'm able to create the things I need to be able to keep growing.
Sure.
So they can look really bad early because of maybe things aren't quite right in that egg from the beginning. And I'd like to make it clear, it's not a fault of the mom.
Sure.
It's very important to point out,
Yeah.
but you know, it does come from the mom. The mom,
Sure.
unfortunately, in this case, contributes the largest part because
Yeah.
it gives those first couple of days of development.
I think what you just said was also quite interesting, because I think, you know, we always believe that the egg and the sperm are equal partners, but in actual fact they're not
No.
at all. You know,
Right.
the egg is
Yeah.
far more potent and powerful than the sperm.
Yeah, it carries a lot of importance for the first, again, for those first couple of days of development. Without it, you know, it wouldn't have the
So much for
energy
gender
reserves.
equality.
Yes.
Yeah.
Yes.
Yeah. Okay. So that's very interesting. So yeah. So regardless of what the egg looks like, as long as it looks alright, you wouldn't really want to pass. You wouldn't really want to extrapolate what the future of that
Right.
or the destiny of the potential.
And even if it doesn't look that good, it would be a case of saying, let's see if it can make a good embryo.
Yeah.
And maybe it's to see if it can make it to day 2 or 3 and let's then transfer it.
Yeah.
Or maybe we even say, let's let it see if it goes to a blastocyst, because sometimes, you know, once it kicks in those genes from the embryo, we can say, oh, this is really actually looking quite good. That can happen.
Yes.